Hello friends, I am Dr. Vijay Prakash and today I'll be talking to you about anterior teeth selection. Now, in a complete denture construction, when we talk about anterior teeth selection, basically the aesthetic part uh, depends on the selection of teeth. And moreover, very importantly, that's the anterior teeth. So, whenever we talk about anterior teeth selection, we have to select the teeth in such a way that we can give the patient the aesthetics, we can fulfill the aesthetic as well as the functional requirement. So, in order to achieve that, we need to arrange the teeth in a natural position and according to the, as I mentioned, according to the patient's demands. So, complete denture are aesthetically pleasing when teeth they are in harmony with the facial musculature, facial profile, facial form, matching the color of the eyes, skin. So all these we need to keep in mind when we are selecting teeth in the anteriors. Whenever we want to do selection of teeth for the anteriors, always talk to the patient, take a proper history, ask for any pre-extraction records. Now, what do I mean by pre-extraction records? Like before having his or her teeth extracted, does the patient have some kind of pre-extraction records? And what can these records be? So these records can be diagnostic cast, photographs, radiographs, extracted teeth, or even if some of his close relative has come with the patient, you can closely observe the relative of that. Now, what is the importance of diagnostic cast? Suppose the patient has diagnostic model or diagnostic cast with him, then it is one of the most reliable aid in selecting and arranging the teeth. You can see the arrangement of the teeth. So if we have an edentulous patient who has got these casts with him, then first thing we can select the size of the teeth, the form of the teeth, the position of the teeth. We can have a fair enough idea where we have to position the teeth in the complete denture. It will be very helpful. And most of the time the patient accepts the shape and form of the teeth which is similar to the natural teeth. So this will be the best, one of the best pre-extraction record which we can have from the patient. Next, we can have ask the patient to have any kind of past photographs. So past photographs which shows the patient smiling, at least some form of teeth are visible. So that will be helpful in determining the width, length, outline, and the color of the shade of the particular teeth. So that will be again helpful for us to establish that. Moreover, close-up photograph can give us the interpupillary distance, which can be helpful in establishing the horizontal width of the upper 6 anterior teeth. So, how do we calculate that? You can have the width of the upper 6 anterior teeth which are visible in the photograph. Suppose they are visible in the photograph, then that will be helpful. Divided by the interpupillary distance which is available in the photograph, that would be equal to the width of the upper 6 anterior teeth, which would be actual, like what you want to get, and that will be divided by the interpupillary width, which is you can measure from the patient's face rather. Next, you can ask for radiograph. Intraoral radiographs will be very much helpful. You can ask for extracted teeth. Some patients have the habit of preserving their natural teeth, the extracted teeth, and these extracted teeth help in determining the shape, size, and form of the artificial teeth which we want to select. And sometimes, although color, if we want to, we can just have an idea of that, but most of the time, since the extracted teeth are preserved for a long period of time, then color will not be possible. Apart from this, we can observe any close relative or the photograph of a close relative, and we will have a fair enough idea how the particular size or shape of the teeth would be. Next, now what are the factors which help in selection of anterior teeth? Primarily, there are three factors. One is size of the teeth, form of the teeth, and the color of the teeth. First, the size of the teeth. So, when we talk about the size of the teeth, we have number of parameters. There are basically 7 ways in which, based on the size we can select the size of the teeth based on these few things, like based on the size of the face, based on the size of the maxillary arch, distance between the canine and the eminence, jaw relations, contour of residual ridge, vertical distance between the ridges, and the lip support. Now let us see each one of them. Now, first method to measure the size of the anterior teeth are based on the size of the face. So here we can measure the average width of the 6 maxillary, the size of the maxillary central incisor, that would be equal to the bizygomatic width divided by 16. So the average width of the maxillary central incisor would be you have to measure the bizygomatic width, which you can measure with, using a face bow, and you divide that by 16, you'll get the approximate average width of the maxillary central incisor. Similarly, the average width of the maxillary anterior teeth, that is all the 6 anterior teeth, that would be bizygomatic width divided by 3.3. Apart from this, the average width of the maxillary anterior teeth can also be measured by measuring the circumference of the head, and you divide this by 10. So that will give you the average width of the maxillary anterior teeth. And the average length of the maxillary central incisor is equivalent to the length of the face, the entire length of the face, divided by 20. So the length of the face is measured by taking 2 arbitrary points, one at the hairline and the other at the lowest edge of the most prominent part of the chin. So you can take one at the hairline and one at the most prominent part of the chin. So you measure this between 2 arbitrary points and divide that by 20. You will get an average length of the maxillary central incisors. Apart from this, you have the Pound's formula that says that you measure the average width of the central incisor is equal to bizygomatic width by 16, as I mentioned before also. And the average length of the maxillary central incisor is equal to length of the face divided by 60. So this was the Pound's formula. Apart from this, you have the golden proportion. Now, Levin advocated the use of golden proportion. According to him, the perceived mesodistal width of the maxillary anterior teeth lies in the golden proportion, that is 1.618 is to 1. So if you see the mesodistal width of this central incisor, it's in a ratio of 1.618 is to 1. And again, this will be in the same relationship with this, that would be 1, and this is 0.618. So on and so forth, this is going to vary according to this. So that is, the maxillary anterior teeth should follow a golden proportion. Next method to measure the size is by measuring the size of the maxillary arch. And how do you do that? You are going to measure from the incisor papilla and till the hamellar notch on one side to the hamellar notch on the other side. You measure all this distance and you will get the entire mesodistal width of all the anterior and posterior teeth. Although this method is not very reliable because you have factors such as the amount of bone loss due to missing teeth, spacings between the teeth, and tooth rotation that may influence the size of the anterior teeth. Next method is to measure the distance between canine eminences. So distance between 2 canine eminences is measured, and how do you measure the distance between the distal of one canine is measured with the help of a flexible ruler to the other side. When you measure from this side to the other side, you will get the combined mesodistal width of all the maxillary anterior teeth. And the measurement will always be done labial to the anterior border of the incisor papilla. Not, you have to always place the ruler like this, not on the ridge or inside it. That will be wrong measurement. Next, when you are doing the jaw relation, the available interarch space will also give you an idea about the height, width and position of the anterior teeth which you are selecting. Suppose you have a greater available interarch space, then you can prefer a longer teeth, and if you are having a very small interarch space, then you go with a smaller teeth, not a larger one. That will look odd. Next method to determine the size of anterior teeth is following the contour of the residual ridge. So artificial teeth, whenever we want to place them, they should be placed along the contour of the residual ridge that had existed before the patient has lost natural teeth. So the knowledge about the resorption pattern in both the maxilla and mandible is actually going to give you an accurate visualization how you're going to place the teeth in that particular position. So the resorption pattern, as we know that as the maxilla resorbs, it becomes smaller in size, and as the mandible resorbs, it becomes slightly larger, although the pattern is different in both the maxilla and mandible. So we need to know about that, and accordingly we can determine what size of the teeth will look best for that particular patient. Next method is vertical distance between the ridges. We had already talked about this in jaw relations, that the length of the teeth is determined by the amount of interarch space. Greater the amount of space available, longer teeth can be used, and if you have inadequate space, then you should use a smaller space. The denture base you can also characterize or personalize to give a more natural look to the patient. Next method is you should assess the lip support. So when the lips are relaxed and apart, the labial surface of the maxillary anterior teeth supports the upper lips, and usually the incisal edges extend inferior or slightly below the lip margins. So when you ask the patient to say 55. So when the patient is saying these words, the lips, the incisal edges of the teeth are going to contact the junction of the wet and dry vermilion border of the lower lip. So that is how it should be. Your arrangement should be such that you have to select the size of the teeth so that you can fulfill this criteria. So accordingly you have to determine where the lip support is and where the contour of your teeth would be. So that will be helpful in determining the size of the anterior teeth. And this will be possible when you are having the properly contoured maxillary rim, and you have tried the maxillary rim at the time of jaw relation. You can just place a single maxillary central incisor in the midline and check whether the teeth which you have placed is fulfilling the lip support criteria. Next important factor in determining in selecting anterior teeth is based on the form of the teeth. So on this you have two things. You have on the basis of the facial form and basis of the facial profile, and also on the basis of dentogenic concept. So first we are going to take on the basis of the facial form. Now according to Leon Williams, he classified maxillary anterior teeth on the basis of the typal form, and his typal form, according to that, he classified into 4 types. You have square, tapering, and ovoid. So these are the 4 ways in which Leon Williams classified. Later this was modified by House and Loop, and they gave 3, that was square, tapering and ovoid, which had 5 possible combinations. So you have the facial form, which is more of a squarish. Here you have more of the ovoid facial form, and this would be more of a tapering facial form. So that will be determining the form, the shape of the teeth. So basically the facial form, whatever the facial form say, this is squarish, the neck of the teeth should follow the same contour. It should be more of a squarish type of teeth. If it is ovoid, the neck of the teeth should be more of an ovoid, and similarly if it is tapering, then it should be more of a tapering. So this is how you select the teeth on the basis of the facial form. Next method to determine the form of the teeth is on the basis of the facial profile. Now facial profile can be, you can have a straight profile, like we can see in this figure. You have a convex profile and you have the concave profile. So accordingly, whenever we are placing the teeth, as I mentioned that you have a well contoured maxillary rim, you place one tooth, and if you observe from the side, it should follow the facial profile of the patient. That is, if the patient is having a straight up facial profile, it should follow that profile. If the patient is having concave or convex, accordingly the shape, the form of the teeth should follow that. So when you observe from the side, the frontal surface of the teeth should appear either straighter, or it can appear more of a convex, or or slightly outward, that is towards the concave profile, slightly outwards. So this will be helping in us in determining the form of the teeth. Next is the dentogenic concept. For dentogenic concept, I'll make a separate video and I'll upload next time. I will move on further. Next is the color of the teeth. So the color of the teeth we take with the anterior teeth. Having all these criteria, we need to know about that the color has 4 qualities, which is hue, chroma, value and transparency. So hue is the basic color of the spectrum. Hue is the basic color of the spectrum. Chroma is basically a saturation. It is the amount of color per unit area of the object, and it determines the intensity of the basic color. And value is basically the brilliance. It refers to lightness or darkness of that object. And transparency is another type of property. It is a property that permits the passage of light through it. Like for example, enamel is more transparent than the dentine. So if we divide the teeth, say, in thirds, so you have the incisal third, the middle third and the cervical third. Now cervical third would be having a greater chroma in comparison to the incisal third. Incisal third would be more of a translucent or more of a transparent in the anterior region. So there is a transition of shade from central incisors to the canine. Central incisors are usually more lighter in comparison to the canine. So canine is slightly darker in shade. Shade selection will also depends on the sex, personality and age. That is according to the dentogenic concept, which I'll take up later. And the factors influencing shade selection are the age. Of course, in a very old adult, you cannot have a very lighter teeth. That will look odd for that particular patient and in his or her personality. So you have to choose according to that. And color of the face is also one of the criteria. Color of the skin, color of the hair, all these are also can influence the selection of anterior teeth based on the color. So while selecting the shade of color, you have to see in 3 positions. One, outside the mouth, along the side of the nose, under the lips with only the incisal edges exposed, and under the lips with the cervical end exposed when the patient opens mouth widely, or when you ask the patient to smile widely or laugh widely. So that is going to expose the cervical areas, and you can see how much of visibility is there when you are selecting the teeth. So what are the prerequisites for shade selection? So whenever you are doing shade selection, first ask the patient to sit straight, and the teeth which we have to visualize or select, you have to make sure that you stand in such a way, that is the doctor stands in such a way that his plane of vision should be perpendicular to the surface of the teeth. So first thing is the shade tab should be moistened. Secondly, you should use a white light or natural light if it is possible. and light should not be focused for more than few seconds. You should not focus directly for few seconds. That should only be for some seconds, and then you should see a blue background and then again come back. So shade is also confirmed at a distance. You should visualize from a distance of 6 to 8 feet, and teeth should always be visualized from different angles, so that any kind of shadows or different light which is falling on the teeth should not interfere with the and or influence the shade. And there should be a harmony between the color of the teeth and the color of the skin and the surrounding tissues, color of eyes and hair. Next, the type of the material which is used in anterior teeth. Two type of teeth, two type of material are used in anterior teeth. Usually, it is the acrylic teeth, and you can also use porcelain teeth. So each has its own advantages and disadvantages. Although you have a higher strength version of acrylic teeth which are cross-linked, which are having a greater strength, and you have adequate wear resistance which are available today. But of course, each material has its own advantages and disadvantages. If we talk about porcelain teeth, then they are more aesthetics and than the acrylic teeth, and they are more resistant to wear. Now, porcelain teeth are retained on the denture base by mechanical interlocking. There is no kind of chemical bonding between the denture base and the teeth. So you have to create some kind of mechanical retention, that is you can have by means of pins which are embedded in the porcelain teeth, that helps in interlocking with the denture base, or you can have diatoric holes, like you have vents here and you have diatoric holes through which the acrylic flows into this and holds the porcelain teeth. So that is one actually drawback of using porcelain teeth, that they are mechanically retained and not chemically retained. Porcelain teeth are resistant to staining, and another drawback of porcelain teeth is that they require greater interarch distance, because these teeth, the ridge laps cannot be grinded in order to adjust that as we do it in the acrylic teeth. And grounded porcelain surface should be highly polished to reduce friction and prevent chipping. Apart from this, there is a lot of sound when two teeth they come together. There is sound sometimes which is irritating to the patient. But one advantage of porcelain teeth is, of course, they are having better aesthetics. Also, they are the only type of denture teeth which allows the denture to be rebased, because they can maintain the shape and size for years. And another drawback of porcelain teeth is they abrade the opposing teeth, that's the natural teeth, because they are having a greater wear resistance, and also materials such as gold crowns, they cause abrasions of the opposing restorative material also. On the other hand, when we talk about the acrylic resin teeth, these in comparison to porcelain teeth, they are less aesthetics. They are having less resistant to wear. Although recently you have cross-linked teeth which are considerably having a greater resistance to wear. One very big advantage of acrylic teeth is they chemically adhere to the denture base. They have softer impact sound in comparison to porcelain teeth, which have more of a brittle and clicking sound when they come in contact with each other. And the acrylic teeth tend to stain more rapidly in comparison to porcelain teeth. They are self-adjusting and self-polished. Polishing shape and form cannot be maintained during trimming. So when you are trimming, you have to be very careful so that you just don't trim it in such a way that they lose the shape and that particular contour of the teeth. Then the wear results in loss of vertical dimension. So For rebasing, anyhow, the entire thing has to be changed. You cannot use acrylic teeth back, and they cause less of abrasion to the opposing gold crowns and natural teeth. That means the acrylic teeth gets worn down by the opposing natural teeth or gold crowns. So this is about the type of material which I used in anterior teeth. So we come to end for our presentation. Thank you for watching the video.